My name is Sarvani Kurganti, and today I will be talking about the different interprofessional approaches to Agbogbloshie in Accra, Ghana. In this presentation, I will first outline what exactly is Agbogbloshie and what is happening there. Then I will go into the different health risks associated with the inhabitants of Agbogbloshie. Then I will discuss a civil engineer's perspective, then the teacher's perspective, and finally, a hazardous materials specialist. Finally, I will discuss the different challenges of these three professionals' approaches, and to conclude, I will discuss the different lessons I've learned through this project. Agbogbloshie is one of the largest electronic waste recycling and disposal centers in the world. This waste comes from Asia, the UK, the US, and Australia. These higher income countries send their waste to Agbogbloshie because the strict regulations in their country makes it very expensive to dispose of. In Agbogbloshie, these migrants collect scrap metal to supplement their incomes. They also cohabitate in the waste dump. These workers disassemble parts and burn off plastic encasements on the computer wiring and refrigerator coils. All this is done without proper protective equipment for anyone in the area. They also burn large piles of copper cables and they add tires to keep flames going. This causes fumes of this fire to spread into the residential areas. Additionally, there is a lot of crime and disease that is rampant to this place. There are many health risks associated with living in Agbogbloshie. First of all, the water and soil from this area contains chemicals that are 100 times more potent than the allowable amount. There are also dangerous levels of dioxins and PCBs in many of the food that is contaminated from this area, such as chicken eggs. There's also intense lead, mercury, and arsenic pollution. The lead levels in the soil are 1,000 to 2,000 ppm, and most of the workers inhale all these chemical fumes. One of the very vulnerable populations that lives in this area are the children. 80% of kids have dangerous lead levels in their blood, and many of the inhabitants suffer from chronic nausea, headaches, chest, breathing issues, and there's seen to be an effect on their neurodevelopment, nervous system, and reproductive systems of the inhabitants. So, what are some potential approaches we can take to address this issue? The first interprofessional that we're going to be looking at is a civil engineer. Although I was unable to get very detailed approaches from a civil engineer's perspective, overall, they decided that it should be important to tackle this issue at the national level. For example, providing houses with improved quality and sanitary conditions at alternate locations could be useful to getting people out of the toxic zone. And another way to get this done is to use trained locals to encourage the community to move. Additionally, developing codes, guidelines, and procedures for recycling the e-waste and to establish acceptable standards is important. Lastly, enacting laws to limit the flow of e-waste by increasing the tariffs on countries that are sending the waste to Agbogbloshie might also be a different avenue to look into. The next profession is a teacher. From the perspective of a teacher, one of the best ways to approach the situation is to tackle education. It could be seen to be beneficial to educate the local community about the toxin exposures and also on HIV/AIDS, mainly through visuals, prints, and different forms of social media. Additionally, laws to protect underage workers should be implemented in order to reduce the harm that this vulnerable population would be seeing. The last profession is a hazardous material specialist and firefighter. From the perspective of a hazardous material specialist, the best temporary solution to better equip the workers that are refusing to vacate is with effective and economical personal protective equipment and procedures. First, workers of this industry should be equipped with coveralls that shall only be worn in the proximity of the recycling operation. In general, 90% of contamination on a person is located on their clothing. By simply removing outer coveralls and storing them at the job site prior to the workers returning home can isolate this contamination. Coveralls are generally inexpensive, easy to store, and require almost no formal training. Along the same lines, N95 respirators are a cheap and effective means of protecting the respiratory system of the workers. And a second area where a temporary solution can be implemented is at the food market. Airborne contamination on the food supply is a major concern. At minimum, food purchased for consumption should be wiped down or washed if possible. As stated previously, the majority of contamination is located on the first layer of food. By wiping down or washing the food, we may be able to remove a high percentage of contaminants and carcinogens prior to consumption. Additionally, food that has been prepared for sale should be isolated in tent structures if possible. While the different professionals came up with very interesting ideas, there are still some challenges that need to be addressed in these different approaches. The first approach is the civil engineers, and the civil engineer decided to kind of address the situation by providing housing with improved quality and sanitary conditions at alternate locations. One of the challenges with this idea is that many people may be reluctant to evacuate their homes. Additionally, a lot of people are influxing into Agbogbloshie for jobs, so it might be hard to keep the population controlled. Another idea the civil engineer came up with is to develop codes, guidelines, and procedures for recycling the e-waste and to establish acceptable standards. This might be hard because much of the dumping is illegal, so it could be hard to regulate. Additionally, developing and enacting new guidelines is a very slow and time-consuming process. The second approach, the teacher's approach, decided to tackle education, and they wanted to do this by kind of educating the local community with targeted lessons on toxin exposure and HIV/AIDS. This might be hard because you might need incentives to convince people to attend these lessons because they do not have much awareness on the dangers, and they also probably don't want to compromise their working day and reduce their income. Another challenge was that they wanted to establish laws to protect underage workers. This also is a little difficult because many kids do come to this dump site to make money and support their family, so it's hard for them to leave. And when tackling the HIV/AIDS risk, there is definitely a lack of affordable care there to properly learn about the different risks the workers there might be facing. The last approach, the approach of the hazardous materials specialist, was to kind of develop PPE protection. This might be a little difficult because there is no proper record of all the workers there. So it's kind of hard to keep track of everyone, make sure they're following the rules, make sure they're wearing their PPE, their N95 masks, and taking it off before they go home. And also many of the people do live very close to the dump yard, so there is a chance for cross-contamination. Additionally, there is no one real boss or no one person in charge of all the workers to be properly distributing the equipment and making sure everyone has it. In general, there's a lack of awareness of the dangers of the different workers. They do not know how harmful these toxin chemicals are, and there also might not be enough funding to make sure every single person has the equipment they need. To conclude, connecting with different professionals and listening to their perspectives on the issues at Agbogbloshie really taught me some important lessons. First of all, I realized that extensive research is required before someone can formulate proper interventions. This could be because there are a lot of external factors that many people without a proper public health background may not be aware of or even consider. Additionally, coming up with approaches also requires concentrated and extensive knowledge on Accra and Africa as a whole. Secondly, I found it very interesting to see that three completely different professionals can all play a role in developing approaches to solve the problem at Agbogbloshie. This reminded me of the interdisciplinary nature of public health. I also saw that even though some of the professionals are from different backgrounds, such as a civil engineer and teacher, they both came up with some similar or overlapping interventions. For example, they both thought to maybe focus on education and develop laws. Thirdly, I also realized that we need a lot of cooperation and understanding from many different disciplines in order to enact change. For example, the individuals who are personally affected at Agbogbloshie and the government all must coordinate and come up with each other to develop a proper plan. For example, if education is an avenue to venture into, we need to recruit teachers. If we want to work on laws, we need government at the city, state, and national level to comply, along with the different organizations and departments in charge of, for example, chemical exposure, waste regulation, and the food department. Finally, while thinking about the different challenges for each approach, I realized just how difficult it is to come up with an extremely effective intervention without any loose gaps. It can be very hard to account for every possible difficulty that may arise, which is why developing interventions as a whole is a very multifaceted and complex process.